So we certainly could get into a little bit of some of the differences between maybe an audiology clinic and a clinic at Costco. I think there's some testing differences, just
Sure.
the way we evaluate hearing is going to be a little bit different. What do you think?
Yeah, so having a doctor start the evaluation by looking in your ear with an otoscope is probably going to be a little different than a salesman that's looking in your ear as far as what they're looking for. Starting an evaluation off on the right, on the right foot and doing it in a professional way sometimes means taking wax out so that hearing test can be as professional as possible, or, and not just professional, but as thorough as possible. So taking wax out before you start a hearing evaluation is very important so that those test results can be as reliable as possible. We also do these tests on the eardrum. We don't just get right into a hearing test. We want to know, is there fluid on the eardrum? Is there too much pressure on the eardrum? You've just traveled from wherever, Pine Valley, some of our patients are in different places and they come down. We want to know if that barometric pressure change is having an effect on your eardrum, and is that affecting the way you're testing today? So, those middle ear tests, the eustachian tube, the ear canal, those are things that we specialize in, and those are also tests that are just not done at the warehouse.
I think doctors of audiology, we're going to be looking for, is there, first of all, just a plug of wax in your ear?
Right.
And we can get it out, of course, if there is.
Right.
I think at some places, maybe like at a warehouse, they couldn't solve that if they found a medical issue right off the bat. Or is there a hole in your eardrum? Is there some kind of mass, a cholesteatoma behind the eardrum?
Right.
We're going to be looking for some more medical issues, things we might call a contraindication to getting hearing aids. Hold on, pause just 1 second. We'll get back to our video. Please like the video, subscribe to our channel, turn on the notifications. We really appreciate it. Back to the video.
Let's get back.
Something that might say, hey, there's some medical issue here that we need to resolve first.
That's right.
So just, the comprehensive nature of the examination, the comprehensive nature of trying to rule out medical issues before moving to hearing aids, I think is going to be a little bit different.
Yeah. Also, one of the things that we do differently at our clinic is one of the number one complaints we get for patients coming in and seeking hearing help is, I don't hear well when I'm in groups. Or if there's background noise around me in the car, or I go to the church environment, or I'm at the restaurant, if there's any background noise at all, that's where I tend to fall apart. I mean, we get this question every day.
Most common, yep.
And I think it's probably the number one reason why people come in is when I'm in dynamic environments, I don't feel dynamic anymore. I want to be able to connect like other people. I want to be able to hear my best. And so we specialize in that type of testing. How do you hear in background noise? How much noise does it take for you to fall apart, or can you hang in there? So trying to understand a patient truly, if it's a hearing issue only, or if this is a processing problem, that's an important thing to know if you're seeking out help. If you're trying to get help, you probably want to go somewhere that actually analyzes how well do I do in background noise.
And in addition to the testing, I think you brought up a point a moment ago where you mentioned follow-up care. Mm-hmm. One huge issue with hearing aids is that they need a little bit of follow-up care. They're not something that you just put on one day and then they're good for the rest of your life.
When you say a little, take me through a normal patient.
That's a great question, because a normal patient, they're going to come in and get some devices, and there's a little bit of a learning curve to getting used to it. So a normal person, 3 weeks, maybe a month, the first little bit, it's going to sound different than you're used to. It's going to feel different having something in your ear. Yeah. And having a doctor that can kind of counsel you about what it's going to be like, set some realistic expectations, help you understand this process, I think is really key.
Right.
So right off the bat, the counseling and the expectations.
Because when you have something normalized, you go from an impaired state or like a handicap type situation where you're not doing well, and all of a sudden your hearing's better, it's an abrupt change. And so they're looking at you for realistic expectations, right? Is it normal? Is it normal for me to flush the toilet and holy cow? Is it normal for me to be doing dishes and I'm putting the dishes in the sink and I'm looking at my wife or my husband or whatever and saying, don't put the dishes in so loud in the sink. It's
the newspaper we're from the 1900s, right?
Well,
the newspaper rustling, those noises, they catch people off guard. And if you're not prepared for that, you wonder, is this right? Is this normal?
Having someone kind of walk you through the process of normalizing and acclimating to what should I be experiencing, it's good to have someone that can kind of walk you through that.
And that's the first 2 months, right? So,
yeah.
So for usually at our clinic, the first month or two, we're just helping people acclimate,
All about
setting these
adapting,
expectations,
yep.
get their brain used to it. Once the brain's good and used to it, then we're kind of off and running. But even then, these devices need a little bit of regular care, right?
Typically, we like to let the patient go after the first 2 months. Let them go about 2 or 3 months and just see how much wax accumulates. Now that something is in the ear canal full time, does the wax change? Does it change in its characteristics? Does it change in the amount? Is it coming out on its own still? Or are we now starting to need a little bit of help from the doctors to try to take wax out? And I'll tell you, and the studies show this too, but it's certainly the case in our clinic, when people wear hearing devices, those individuals who have had a little bit of wax accumulation in the past, not a lot, but a little, by wearing a hearing device full time, that wax becomes more significant. It becomes a bigger issue. And so those patients, follow-up care, their schedule for follow-up might be every 2 to 3 months they come in for us just to quickly suction out the wax or just grab it quickly, because as wax accumulates and you put something in the ear canal to give, extra sound and facilitate a problem, kind of give that individual closer to normal hearing. If that tip is in there and there's wax, it's kind of a blockade. It's kind of an impedance, right?
And this isn't a personal hygiene issue. Sometimes people are embarrassed. They're like, sorry, there's wax on my hearing aid.
Right.
That's normal. We expect there to be wax in an ear. We expect there to be wax on a hearing aid. But I think the bottom line is hearing aids need regular maintenance. Even if you're the cleanest person in the world,
right,
your ear's going to produce some wax. Even the cleanest person in the world sweats a little bit.
That's right.
We all have oils in our hair and skin. And hearing aids are being worn on the body. And because of that, you're wearing this thing 12 hours a day. It's exposed to all this stuff.
Yep.
It needs to be cleaned at least every 6 months.
At least.
And for some people more often.
Interestingly, there are these little filters and cap domes, or we sometimes have these invisible custom-made ear molds. They need maintenance. They need to be suctioned out. Moisture builds up.
Yeah.
And so there's different solutions and there's different materials and equipment we have that really help maintain the device. When I talk about maintenance, I'm talking about helping the device operate at its optimal level, not just for a week or two, but we're really trying to see if that device can last 5, 6, maybe even 7 years.
The longevity of the device, it makes for a better investment if you just take care of it along the way.
Yep.
And that way it lasts you a long time. You feel like you got your money's worth. It feels like a good investment.
So when you're considering getting hearing help and you're considering maybe I'm a candidate for a hearing device, clinics like ours, clinics where doctors of audiology and a full service, an array of services are there to help you maintain your hearing health, your ability to process, but also to help maintain the product so that you're getting the best value, the best long-term value, which can be better health, but probably better cost savings.
Yeah,
also.
yeah.
So
I like
huge.
that. So I think if I'm thinking about getting a hearing aid, I think the best place to go is a comprehensive clinic.
Right.
If I'm thinking about getting a pumpkin pie for Thanksgiving,
right,
or like a case of ketchup, I love Costco.
Okay, everybody, we so appreciate you watching the video today. If you've liked what you've seen, please like it, subscribe to our channel. It means the world to us, but it also means the world to other people who are trying to figure out what's going on with their hearing health. So thank you for watching.